A new report from the nonprofit Environmental Working Group shows millions of Americans are drinking water tainted with unsafe levels of chemicals, metals, and radioactive substances. In its annual update to its tap water database, the group analyzed water quality data taken from nearly 50,000 water systems across the country from 2021 to 2023, and it found 324 different contaminants in drinking water. A 2019 study from the EWG found toxic mixtures of 22 carcinogenic chemicals in the U.S. drinking water could play a role in more than 100,000 diagnosed cancer cases nationwide. The report released Wednesday identified long-lasting polyfluoroalkyl substances, or PFAS, in all 50 states and 4 U.S. territories, and found that levels are actually highest in major metropolitan areas. PFAS are also known as forever chemicals. Sydney Evans joins us now. She's a senior science analyst at the Environmental Working Group. Thank you so much for being here, Sydney. How significant is the number of Americans exposed to PFAS, and what do these toxic chemicals do to the body?
I think most people would be shocked to learn that just about all of us are exposed in some capacity to contaminants in our drinking water. I think a lot of people take for granted that when they get water through a community water system that it's been treated to legal limits, but that doesn't mean that there aren't any contaminants, that those contaminants aren't at unsafe levels. We see a number of different contaminants with a range of health effects, many of them carcinogens.
And so the EPA does set maximum contaminant levels for chemicals, but the study notes, quote, what is legal is not necessarily safe. Do you agree? And in your view, what should be done?
That's correct. There's usually a pretty big gap between what we see in the research for what is safe versus what is actually legal. The gap there exists because of the delay that happens sometimes between the publication of this health-based science and the actual setting of those legal limitations and the process that it takes to go through and set those limitations. Only about 90 of those contaminants are actually regulated, even though we see the presence of over 300 across the water in the United States.
And the study also found nitrates, radium, chlorine disinfectants, all in U.S. drinking water. How do these harmful substances get in?
It can be a range of things. There are some contaminants that are naturally occurring, like arsenic, which can come from bedrock. But a number of the contaminants, for example, like PFAS, are fully synthetic and only there as a result of industrial pollution and other uses.
What are some steps that people can take to make sure that the water they're drinking is safe?
I'll first say that I don't think the burden should be on any one person to make sure that their drinking water is safe.
Fair.
That being said, it's possible to filter your drinking water at home, and home filters really do work in reducing the number of contaminants as long as you're using the right kind for the contaminants in your drinking water, as well as maintaining it properly over time.
I want to ask you something before we let you go, and that is Utah could become the first state to ban fluoride in public water systems. Right now, some cities and towns do it. This would be the first state. A lot of other states are watching. It could set a precedent. What are the health and scientific arguments for and against this?
So fluoride's a really interesting one because it's one of the very few things that I think I've ever studied where there is some benefit shown at low levels. It definitely can be toxic and have health effects at higher levels, and it's a matter of really investigating the science to see where that benefit might be or what the harm might be of adding it to water as well. At the moment, by removing fluoride from drinking water, the most likely people to be impacted would be vulnerable populations like children who have a big benefit to their dental health. And there just aren't enough dental practices and health practices in place to take care of those vulnerable populations if fluoride's completely removed from drinking water. But ultimately, ideally, we would be in a place eventually where that support does exist and fluoride isn't necessarily needed to be added to water.
Sydney, we don't have a ton of time left, but I'm going to violate every journalistic rule and go back to something I asked you earlier because I said, what could people do? And you said you don't think it should be on the burden of everybody. So who should the burden be on?
It should be on the polluters. And I think that's really all there is to say.
Sydney Evans, thank you.